Hi, my name's David Anderson, and I'm Professor Emeritus at George Mason University. I'm glad to be sharing some thoughts with you today about planning, part of the strategic prevention framework, which is embedded in prevention with purpose. It's hard to believe, but I've been involved with drug and alcohol misuse prevention for 50 years. I started in 1975. And planning is so important, and that's what I want to emphasize today. Three main things. It's vitally important. It's a lot of work, but it's most rewarding. So think about planning. You know the seven P's. Proper prior planning prevents pathetically poor performance. Seven P's. So planning. Would you believe that there's a field of study called planned change? So as you think about that, planned change versus unplanned change, I think we would be more embracing of being more planful. That's what strategic planning is. So as you're thinking about your campus efforts and the planning part of the strategic prevention framework, you've already done the assessment phase. So what does the data tell you? What does it tell you about higher risk groups or settings or situations or needs? What is your vision, your overall goals that come from that? And then you start to think about what is it that you want to prevent and what do you want to promote with your campus? All of that is part of the backup, the background, the foundation for your planning efforts. When you look at prevention with purpose, there's an outline there with multiple elements. You need to prioritize because you can't do it all. You prioritize, and they talk about issues of importance and changeability. There's also the Eisenhower matrix you might want to check out, which is a matrix of importance and urgency. So that's part of your prioritization. Then you're going to select some strategies, some approaches, policies, programs, services that are, again, are needs-based based on your assessment, and make some selection. You want to do some things that are evidence informed, that they have good foundation, good data behind it, good evidence that it works, some good theoretical grounding for it. And part of that selection process is what's locally appropriate, what's appropriate for your campus at this point in time. It may not be appropriate 5 years from now and may not have been appropriate 5 years ago, but what's appropriate now? Then what can be implemented? Be realistic with that. And what's important, and again, you've already looked at capacity, again, part of the steps of the strategic prevention framework, thinking about campus partners and thinking about traditional partners and non-traditional partners, thinking about student government, thinking about faculty, student projects, there may be volunteers, there may be other campus offices. And so what can you realistically do with your capacity? And then with that, you build a plan, and that ties into your logic model. Again, grounded in your needs, looking at evidence-informed approaches, and then the logic model with some specific outcomes, short-term and more long-term. So again, thinking about those seven P's of planning, proper prior planning prevents pathetically poor performance. Or another way of saying that is proactive and participatory planning promotes positive processes and progress, because that's what we're all about. We want progress. We want to reduce those harms, reduce those injuries, and promote the positive potential with our students. So what I love about this step is it's organized, it's grounded, it's engaging, and it's rewarding. So again, three things to think about. This step is vitally important. It's a lot of work, but it is rewarding. And along the way, I hope you can have some fun with the planning step of the strategic prevention framework, part of prevention with purpose. Thank you and enjoy the journey.